Hey everyone, this is the Shut Up or Talk Up Wellness Lifestyle brand. And as you know, we focus on mental health, emotional health, and physical health. Our goal is to connect wellness and share that insight with the community, with men and women. And one of our latest edition is the Health Talk, where we are having a series of conversations with healthcare providers, wellness and health providers so that we can essentially get this information and share it with you. And you can go ahead and seek out, further information from these providers if you feel to do so. Today, we have the honor of speaking with Dr. Karen Agarwal. I'm sorry, I apologize.
No, that's perfect.
How are you doing this morning?
Oh, it's a beautiful morning here in England, so all good. We rarely get this type of glorious spring bright weather.
Oh,
And it's
wow.
Easter Monday and it's bank holiday, so
Oh, wow. What's the temperature? What's the weather
so
like?
it's just high 18, 19. So yeah.
Yeah, well, that's good.
Perfect. Perfect.
The
Yeah.
sun is shining, so that's awesome.
Yes.
So I want to say thank you again for joining, and we can get right into the conversation. Can you explain to the audience your position as an ENT and your experience? Um, and then the reason why I wanted to is because some people they only know about primary care doctor. They don't understand the importance until probably later on. So I think it's so important for our audience to understand what your position is and how vital it is.
So first of all, well, thank you for inviting me to do this health talk and be part of it. Um, you know, I am sure that it will resonate with some of the people who are watching whole of your talks and see what there's benefit for the individual. So it's a great initiative. So well done. And in terms of myself, so I was ENT specialist before, and now I'm a GP as well as I do ENT as a specialism. So I'm both a primary care as well as an ENT kind of community specialist.
Awesome.
So
And so go ahead.
so it's a combination, like I can kind of deal with the general problems, but the fascinating thing I find that I understand the medical ENT problems now better, because now I see this as a whole body rather than just focusing on the ears, just focusing on the nose or head and neck problems. I'm not kind of saying that that ENT specialists are are not kind of informed, but I think you see things differently when you have that important kind of understanding of how the whole system works. So I definitely feel that this kind of two-way approach helps me to understand, and I hope it reflects in how I treat my patients.
Oh, that's awesome. And just correct me if I'm wrong, essentially you're explaining how that, as a specialist, right, you focus on ENT, but then taking another route, you're able to combine it and really appreciate how you see the connection
Yes.
with that as well. And I think that's definitely important and a benefit for your patients as well. And when you have patients, do you see them, do you do like online visits or in office? How does that work? If someone wanted to see you in the
So I'm
UK?
broadly working in the NHS, National Health Service in England. So patients directly access our appointments who are registered on a list. And then I have a very small private practice, which I started recently, and that is in UK, in Surrey. Basically, to get a bit more appointment time, because I like spending time understanding the person, what matters for them, who they are as an individual, rather than just kind of in that conveyor belt approach of medicine where you just see the problem, do the diagnosis.
Oh, wow. Yes.
So I was finding that I needed to spend more time with my patients, and that's why more recently I ventured out to have a little bit of private practice, because it gives me that time which I
Good
can spend.
time.
Yeah.
Yes, and that's definitely important. Can you explain to the audience what is the role of an ENT?
So ENT is ear, nose, throat. And I think in terms of my overall practice, say, even like the general practice, every third or fourth patient will come with an ENT problem. So it can be an infection, it can be a congested nose, it can be a problem with the throat, or it can be something more like, obstructive sleep apnea or headaches, or, it's vast majority. And one thing which I'm really passionate about is combining the whole approach, the whole body approach, the lifestyle approach to ENT problems, especially when anything, and this is from my overall experiences, anything which is long term, so something which is not acute and quick fix, something which is long term, we have to see this as a whole rather than just focusing on the issue. So just give you an example, this week my Insta theme is on reflux. Now, if I just focus on reflux with ENT, I'd be just looking at, your reflux has got many problems, but in ENT, well, it'll be hoarse voice, it may be a bit of a sore throat, feeling something in the throat. We'll be just telling them most of the time, yes, we will advise about lifestyle, but most of the time, take these medicines and get on with it. But now I think differently. Like now I see, why is this person having reflux? How do I treat that reflux rather than treat the damage I'm seeing on my investigations from reflux? Does it make sense?
Mm-hmm. I see what you're saying. Yes, it makes sense. I see what you're saying.
Because I want to help that person get rid of the problem,
right,
rather than just treat the problem.
Problem.
Getting rid, I mean, we may not be able to completely kind of cure it, and I would not make any claims, but we would be able to certainly diminish it if we approach it differently. And this is the kind of the pet peeve I have also, that why doesn't the whole medicine work this way?
Yeah, I see what you're saying, because it's a benefit. It's like customized care, right? There may be different types of care or how to approach it, and depending on the person, depending on even if it's if their background or just their other health complications that may contribute to the care as well. So I definitely think that's important. And what when we talk about ears, nose, and throat, right? That's the ENT. That's the specialization. But I'm glad that you expanded it so you can give that dual support and extend and have more time, as you mentioned. You did mention something about sleep apnea. Can you explain to us, the audience, what is sleep apnea?
So one of the common reasons we see patients with they're tired all the time, or they have problems with sleep, or exhausted despite what they think everything they're doing right. And one of the questions we forget to ask as doctors is, how is their sleep? Now, sleep problems can be, something because they can't sleep even if everything is right, or there can be sleep problems where they actually are doing the best and everything is fine, but the mechanism is failing. So there's obstruction of the air when they are sleeping. And that is what obstructive sleep apnea is, and that's the commonest thing we deal as ENT. So basically what happens is the person is trying to kind of just sleep, and they're waking up multiple times during the night because the airway is getting obstructed because of either large tonsils, or they have problems with the airway in some form, like large tongue, or some relaxed kind of airway. So it just blocks, and when it blocks, the natural thing is to wake up. They may not remember waking up, but it is just those small micro problems during sleep which affects their sleep. Now, it starts as a small thing, and then it starts becoming more systemic. It starts affecting their heart, it starts affecting their memory, it starts kind of causing problems. They actually have, if you look at obstructive sleep apnea, it's an independent risk factor for stroke.
Oh, wow.
Yeah. So you're I think 15 to 20% more likely to have stroke if you have got obstructive sleep apnea. Apart from that, the broken sleep, it's a problem, with driving, so the increased number of motor vehicle accidents. And these patients usually tend to snore, so they're affecting kind of relationships. So when you start looking at it, the whole picture, you start seeing that how it can affect not only that person, their relationships, their families, the communities from accidents. So that is the joy of understanding it in a whole form, is that not just treating that one problem, but if when you start explaining this, rather than just saying, oh, you've got obstructive sleep apnea, when you start
Right.
making the connection.
Yes.
So when I'm seeing a patient with obstructive sleep apnea and they've got other things, like they usually will have a heart problem or another kind of issue with their kind of overall health, like diabetes or blood pressure. And then you tell them, look, the problem is that your sleep is not good. And are you working on it? And they'll go like, yeah, I'm using my machine, but they may not be using the machine properly, or they may not be aware of certain lifestyle things which are actually adverse. So my tagline is, there's no safe limit for alcohol if you've got obstructive sleep apnea, because alcohol causes the obstruction to get worse. And we have to just be open and honest with what is the problem and how they can help themselves. If we don't even give that useful information,
Yes, yes,
how is the person going to act on it?
yes. So you said alcohol
There's no safe
worsens.
limit. Yeah, yeah.
Oh, there's no. Oh, wow. That's so important to even know. I mean, especially because some people may think like, okay, well, if I'm drinking alcohol, what does that have to do with my nose or my ears or my throat? And that's why you explain how most of the time people that may have sleep apnea, they may have something else, not all, right? And how it can be linked to something else or a trigger. And I'm amazed to know that that's something that contributes to it or can make it worse. And
Yes, yes.
that's very interesting, and it's good to know, definitely. What are, as far as the sleep apnea process, so how do one get that resolved? Do they go through surgery? Do they do testing? What is that process?
So again, it's case to case basis. It depends upon, what is the reason why they have obstruction. Sometimes, especially like in kids and stuff, it can be so sleep apnea can affect kids as well. And their reason for them is different. So in those cases, it's a bit easier because you can take the tonsils out, you can remove the adenoids, you clear the obstruction, and lo and behold, they're sleeping better, their attention is better. I have seen multiple examples where kids have been labeled with ADHD because they're not sleeping well. They've got sleep disordered breathing. So essentially, when there is a problem like this, we have to again go back and see where are the underlying
Right.
problems.
Yes, and not to miss any steps. You have to to solve the problem or to address or to find better care, you have to you got to go step by step to see what is this person's daily lifestyle process, what's missing. And sometimes, we just think go right to the problem. And like you said, we need to figure out what is this person's daily routines, what are their I guess conditions, and then pair it so to better educate them so
You're
they can.
absolutely right. So very simple thing is that if somebody has got a long-term condition, we go back and see where that building block is not being maintained, and then see if there is kind of connection between that and the condition. And you will find like 2/3 of the cases or more will have that connection. So if you sort this out, that will just get better anyway.
Okay, yeah, yeah.
Yeah. So for obstructive sleep apnea, just in adults, it can be mild, it can be moderate, it can be severe. So we have to first, understand what we're dealing with. So I always say safety first. So you need to know where this person is. So no false promises. If somebody has got severe sleep apnea, they have to probably kind of, get on with the machines and work on lifestyle. But if somebody has got mild sleep apnea and they want to kind of, you can't try lifestyle interventions intensively, they may be able to reverse it and stop it from going progressively worse. So first case to case basis, knowing where this person's kind of, severity is, and then kind of applying the lifestyle principles along with others if need be.
Okay, that's definitely important and a great method to approach that. In regards to sleep, can you tell us how important sleep is? How much sleep should a child should be getting, or adult, in this fast-paced world where everyone is just running? How important and
Gosh,
valuable is sleep?
gosh. I mean, that's $1 million question. Like, how important is sleep? And again, sorry, I have got lots of these phrases which have just come on recently when I've started talking about these problems more. I sometimes say to my patient, it's easier to go to the moon nowadays than to have a good night's sleep.
Oh, that is so true.
You know, it's becoming more difficult for people to have a good sleep, and sleep is so important. We should not neglect it. You know, I, as a doctor, even 10 years ago, when I was doing all the sleep lectures, I did not realize the way we were taught was, oh, insomnia is when you have got everything right, but you can't sleep. It does not have adverse health outcomes, versus sleep deprivation, which is different. So even if you look at my appraisal, we have to put all our learnings and stuff. So I was looking at my learning myself, like 10 years ago, I was saying that myself. And now I'm a bit more open, like, more understanding, being a generalist. I'm like, gosh, sleep is so important. It's so important for our bodies to rest, to recover from all the days kind of work it has done, the brain to kind of, filter all the stuff it wants to restore and kind of, get rid of the ones it doesn't want to. So it's an active thing. So for sleep is, even though you're lying in bed and say, for example, somebody's having a good night's sleep, it's an active process. Your body is still working on those useful things. And that's why when you wake up, you feel ready, you feel refreshed, your body is kind of in alignment again. How to get good sleep, that's very, very kind of important. And I usually follow Matthew Walker. He is very famous sleep scientist. He's from University College London, UK. So I've read his book, Why We Sleep, and I usually hand out all his leaflets out to my patients and say, go home, look at this, because sometimes we think we're doing everything right, but maybe the information source we have is not giving us the right picture. So source of information is also important. So I gently just say to my patients, look, I'm sure you're doing everything right, but here is the more up-to-date information about this. Why don't you have a look in your own time and see if there is anything you can change? And 8 out of 10 times, I found that people can change something.
Oh, wow. That's
And
definitely.
one of the other common things I hear is that I eat fish every day because fish is healthy, because that was how it was, like, a few years ago. But the information is changing, and that's why we have to do this refreshers.
Always, and to give people insight on that. I mean, do you think people are suffering from sleep deprivation? Do you think more it's a suffering situation to not be
I,
able to sleep?
I see a lot of patients who cannot sleep properly. So when somebody is coming with tiredness symptoms, we obviously go through our standard guidance of what to look for and stuff. But one of the important questions is asking about the sleep. And more number of times than less that I found that people are not sleeping well. And if you're not sleeping well for 1 or 2 nights over a big period of time, it doesn't matter. But if you're not sleeping well consistently, you are going to get problems in the long term, because your body is not getting that period of rest and recovery. And sometimes I use the analogy of a phone. So you cannot keep your phone using your phone all the time.
Oh, that's a good thing to point out.
Yeah,
Yeah.
it will heat up. The machinery will heat up. You cannot continue using your car without giving it a break. So we have to just understand our body is also a kind of a machine. It's
Yes.
working all the time. We have to recognize and respect the fact that it needs to stop.
Yes, and even with and and we're gonna wrap up shortly, so I don't wanna I don't wanna hold you too long, but with the sleep deprivation and having that, um, I remember just, being in school and studying, sometimes I felt like my body was tired, but my brain was up. And you brought up the cell phone. how, I don't know how, if people realize how sometimes our cell phone and the use of it, the excessive use of it, it's a part of why our brain is just always on. I mean, that's my perspective, is that.
Yeah, and you're absolutely right. And this is exactly what we see, that you're physically tired, but you're mentally so active. And for sleep, we need the opposite. We need the brain to relax, and obviously we need physical tiredness as well. That those are the fuels for sleep. So again, when anybody reads Matthew Walker, you'll find the terminology sleep fuel. So to be able to sleep, you need certain kind of ingredients. So for example, even if you're cooking something, you need some ingredients. So you need a physically tired body, you need a kind of relaxed brain, you need the right environment, you need the right things during the day. So it's not a simple thing. You just have to go back and review, and it's easy. Once you start looking at those things, you find, okay, well, I maybe have to, my brain is active, maybe I need to do some meditation.
Mhm.
Yeah, maybe I need to do some breathing exercises to
Right,
kind of calm my brain.
right. Yeah,
And
I
that,
mean, something else I wanted to mention, do you also assist patients with something, I think it's called GERD?
say again?
GERD, I think it's, I don't know if I'm pronouncing it wrong, because I don't have a medical back.
With gastroesophageal reflux disease.
Yes.
Yes, yes. So that's exactly what I'm talking. So it's a reflux. So that's exactly what I'm talking
On
on
your
the
page.
month. Yeah.
Yeah, so can you tell us a little bit more about that?
Sure, no problems. So basically, the way I explain reflux is that your stomach contents, they're going up the wrong way. So instead of going kind of, going down where it should be to the intestine, they're going up the gullet, and it's called reflux. The problem is that the valve between the gullet and the stomach, which is supposed to be tight and functioning well, it just is not working properly. And there are multiple reasons for it. The reasons can be from outside, because you're pregnant and there's pressure on the stomach, so food is going on the wrong way. Pregnant ladies have got this problem majority of the time. In more physiological ways, if you look at it, if you're obese, if you've got more weight around your abdomen, it will press on the stomach and cause the valve not to work properly. Or if you're making choices like, very fatty fried foods, or, alcohol, again, sorry, alcohol, or smoking, that will stop the valve from working properly, and the reflux will be more. So there are lots of things, once we get the right information, we can make better choices.
Yes. And lastly, before we wrap up, I wanted to talk about the ears.
Yes, sure.
You know, when I was growing up, we had like the big walkie-talkies, or my mom, if we didn't have TVs in our room or anything in my household with my
That
parents.
would be the right thing.
Yeah, so, but whenever we was around it or listening, my mom said, turn the volume down a little bit. You don't want to damage your ears. What is your perspective about how we are damaging our ears as a whole, as a society, with the equipment that is accessible, faster, it looks nice, but it's going to damage us in the long term as far as hearing. What's your perspective in regards to hearing?
That's a very good question, Marley, because you're absolutely right. We are kind of, using this fast technology and this louder noises more and more, bit like junk food, I say. So hearing loss, when you look at the globally, like, it's one of the burdens. I think comes in the top 6 health burdens for global economy.
Wow.
So hearing loss is huge. So to protect your hearing, we have to understand that how is the hearing working? It's because your sounds are being picked up by the little kind of hair cells in cochlea and then going to the brain. When you put loud sounds, you are damaging that mechanism, and you are going to have what we call technically noise-induced hearing loss over a long period of time. And then you get particular frequencies where you see the dips. And unfortunately, once you get that to that stage, it's not fully recoverable. And in some cases, it can't be recovered. So yes, your mum is right.
Oh, yeah. Well, thank you, Mom. Because, and when I see these devices now, I get worried too. Like it's so close. And I think that, and even with using certain things with moderation, right? Because it is convenient,
Yeah,
but you know,
moderation where it is kind of audible levels is fine, but loud sounds, we're talking
oh,
about
okay.
really loud sounds. So we're not against technology, we're not against kind of anything, but we have to still work with our body. So yes, choose things rightly and not too loud sounds over a long period of times, because that is bound to cause long-term damage, as you said, Marley.
Yes, well, thank you so much. I mean, and I just want to thank you so much for sharing all the insight you have shared. We can't wait to get this out to you guys. Do you have any last words or insight that you can share with the audience? We do want to let them know to go to your page, and we're going to make sure we have that credentials on the bottom. And we want you to share that information as well. But as far as you as a provider and the issues that you may see. What are some last tips that you can share?
So the most important thing which I'm really passionate about is that health is so important. Make an investment in your lifestyle. You will get major rewards from it. And if you do unfortunately have a long-term condition, do not just look at the medicines, look at other ways of improving your health. You may be surprised how you can improve your even long-term conditions by doing certain things which may not be as difficult as you think.
Wow, that's definitely important. So if you're home, if you're somewhere and even preventative measures in advance before something happens, it may be hereditary. But if if it's hereditary or if it's something that you can bring onto yourself, you try to think about your lifestyle, and incorporate like you said, and I think that's so important. I want to thank you so much for joining us. Before we go, can you tell everyone your social media page and how they can learn about all the many things that you're sharing weekly in regards to ENT?
Yeah, no, and thank you for having me, Marley, again. It was wonderful chatting to you and sharing your and and myself on this platform. So my social media is very new, so please don't judge me on that.
Oh yeah.
It's called ear, nose, throat underscore integrated care, because I truly believe in integrating all the benefits from different types of medicine for my patients. I'm not signed up to anything in particular, it's my patient's care I'm signed up to. So ear, nose, throat underscore integrated care.
Yes, and keyword integrated, which is
Yes.
important and which brings everything full circle when you go that approach. All right, Doctor, I just want to say you thank you again for joining. And everyone, thank you for watching. We can't wait to get this to you. It's so important. This is the Shut Up or Talk Up Wellness Lifestyle brand where we focus on mental health, emotional health, and physical health. And this is the Health Talk. Thank you. Bye-bye.